boundary setting, holding emotional space, feeling unsafe, gaslighting, self-care. These are a few of my unfavorite, overused therapeutic terms that I feel should be stricken from the English language, or at least banned from use in most metropolitan areas. Today we speak again with Mary Catherine McDonald, PhD, about the offending therapeutic terms in question, or, as she likes to call it, access without education. The good doctor discusses the ways in which these terms and knowledge of psychology are misused by those who lack the education to, well, know what they're actually talking about. We also touch on how the pandemic may have spurred on this viral spread of therapy speak, as well as the roots of knowledge itself. How do we know what we know? When can you say, yes, I really have this thing? And apropos of nothing in particular, I discuss how much I hate the Myers-Briggs personality test. Thank you for listening. And remember, if you would like to become a Patreon member, see the link in the program notes. And why would you do such a thing, you ask? Well, to have your amazing questions about psychology answered on my special Q&A, to receive handy-dandy PDFs pertaining to your amazing question, and possibly, maybe, in the dead of night when no one is looking or listening, receive super secret, untoward, unsettling, and downright slanderous recorded clips that may shake the very foundations of your reality. That's why. My name is Benjamin Russick, licensed marriage and family therapist, and this is my podcast, Look, Just Tell Me What to Do.
Today is the day that Thoreau died.
Really?
Yep.
Today is the day that Thoreau died, ladies and gentlemen. You heard
we're recording.
You heard it here first on Look, Just Tell Me What to Do. It's a bombshell announcement.
This is the kind of friendships that you have when you're an academic. You have friends who text you only about the days that certain other activists
If I had a friend that did that, they'd not be my friend anymore.
Why?
Because don't spam me with useless information about dead poets.
Well, no. So the background, though, is that we collaborated on a paper at a conference about Thoreau and Emerson. And so we bonded over. So there's a deeper significance.
Boring.
Anyway.
Dull. No care.
Do you want to know what it says on Thoreau's headstone?
Oh, God, what does it say?
Now comes good sailing.
Oh. That's sweet.
Right?
What a good writer he was.
I know.
Anyway.
Tortured soul, by the way.
Yeah. Never had a girlfriend, right?
I don't think so, actually.
And didn't him and Virginia Woolf live at the same time? Excuse me. Emily Dickinson.
Oh, yeah, I think so.
They both, never had sex. It's why didn't we get these two together?
I know.
Anyway, so...
Here we are.
After a little bit of requisite banter.
Yep.
I'm here with Mary Catherine McDonald, PhD.
That's me.
And we are discussing...
Access without education.
What does that mean?
See this as kind of an offshoot of the last episode that we did on diagnostics. We talked about this, but not directly in that episode, where you have tons of access to psychological stuff, to diagnostic codes. Anyone can buy the DSM. I've seen people have it on their coffee table as a kind of a joke. You can Google your diagnosis, all this other stuff. There's a lot of therapy words and communication that's finding its way into society, into everyday colloquial conversation. And there's a total, complete lack of education to scaffold any of that access.
Yeah. So we all started off when we read this fabulous article on people using therapeutic language to kind of bludgeon people like ill. Setting boundaries as a way of really cutting someone off and being incredibly rude. This therapeutic language gives you the ability to be a shithead, essentially, while it's sounding like you're being kind of holier than thou. And I'm just setting a boundary, and I'm practicing self-care. The reason I didn't come to your cocktail party or gala or missed your birthday or wedding is because I was practicing self-care, not because I'm a goddamn flake and because I'm a lousy goddamn friend, but because I was practicing self-care and I was making space for myself.
And I'm drawing a boundary, and you need to respect
I've been at capacity. How should we punish people like that? If you were queen of the world, how would you punish people who use those kinds of words?
I would want to wave a magic wand and remove the words from their brain.
Oh, that's way too nice. No, you have to be more draconian.
More punitive. I'm not really that way is the thing.
You've got to, yes, you are.
I am.
You so are. Come on. Dig deep, MC.
Because here's the thing. If you remove the language from their brain, they're going to want to use the language. They're going to reach for the language, and they're going to be forced to say something more nuanced.
But the thing is that people that use these kinds of words and really step into it are fundamentally terrible people. So what's going to happen is they're just going to create a new shtick of some kind. They need to be punished. They need to be jailed, banished,
or made to, write a 10,000 page essay.
Does this come up in your practice? Do you see this with clients?
Using therapy speak?
Yeah.
No, I don't think patients like that stick to me.
Yeah, same.
Like I had a woman inquire about couples therapy the other day and I quoted her the cost and she's like, that seems really steep. I think I'm going to pass. I promise you she uses words like this.
I've had to actually refer clients out for this.
Really? Tell me about that.
There are clients that will come in. It's very clear that they've got some legitimate stuff that they're working on. And then they've picked up this language of boundary setting, self-care, and abuse. And they use it against every single human being in their life.
Oh, Jesus.
The Starbucks barista mispronounces their name and they're an abuser.
Really?
Yes.
They'll actually say that.
That is a literal example.
I've never heard anything like that.
Friends of theirs will make a misstep, as friends do in friendships. A friend will disappoint them somehow, right? Like they'll have an event that their friend wasn't able to attend or something. And then that friend will be cut off via a series of what I call rage texts that are very similar to the ones in this article, which by the way, the author's name is Rebecca Fishbein. The article is called "Is Therapy Speak Making Us Selfish?" The answer is yes. They use this kind of method against every single human in their lives and they start burning all of their bridges. And I'm not exaggerating. It's like family, partners, friends, and then kind of random acquaintances, coworkers. When I see that in a client, I have to say, first you kind of push back and you say, it really sounds like you might want to pause and reflect before you make any more choices like this because you're burning down all of your relationships. Can we talk about that? Can we think about that? What are the implications? Are you sure you want to cut off your family? Of course, there are situations in which you have to, but it's important to take that decision seriously,
Mm-hmm.
And then I'm met with, you're an abuser.
Jesus Christ.
You're gaslighting me.
Wow.
And it's like, okay, so now you've said that I'm gaslighting you. And so we can't possibly continue because you don't trust me.
How do you terminate when you have someone you just don't like?
There's a difference, I think, when it's someone you don't like. In that situation, it's clear that I'm not going to be able to help them, right? When someone says to me, this has happened very rarely, by the way, this is like 2 or 3 times, where if someone says to me, you're unsafe or you're gaslighting me, I feel it's unethical for me to even try to continue that relationship with that client because if they feel that I am abusing them, how is it possible that we stay in relationship together? And so I will say, okay, look, that's totally fair. Your assessment is
that you're abusing them.
I won't accept that I'm abusing them. I'll say that your assessment is a valid statement of your feelings at this time. I don't feel like we can continue in the relationship. And really interestingly, the only times I've done this, the person has pushed back really hard and said, no, I want to stay. And I will say, I believe that is a waste of your money to continue coming to me when you clearly feel that way. Let's find you a clinician in your zip code who works on these things and who you're going to maybe feel more comfortable with. In my practice, I've seen this maybe 2 or 3 times over the course of 10 years, like this tendency of people to lean into therapy speak and use that therapy speak as a weapon. One of the reasons that is possible is because we have access to this language without the educational scaffolding to understand what that means. And so in our last episode, we talked about the DSM and how because anyone can Google PTSD and the first thing that comes up is the DSM criteria, then people think they have this piece of psychological knowledge, but what they're missing is the entire historical scaffolding that brought us to that page. And then also all of the nuance and complication that can't be included in the single page about what it means to be diagnosed with something. And
Can you give an example of that?
One of the first kind of most obvious one that comes to mind is that there are 3 things that count in the DSM currently as potentially traumatic. People will come in and say, I don't have PTSD because I don't meet this particular criteria. Or someone will say, I dated this person who is selfish and they're a narcissist because they see that selfishness is one of the criteria under the entry for narcissistic personality disorder, which in and of itself does not make it.
Very static thinking.
Yeah, black and white, very rigid. Yeah.
Can you give an example of how the DSM has evolved and changed and how the diagnoses have kind of like morphed over the years?
Yeah. So the DSM, I don't think people realize this, is in constant flux. It's not like a singular static thing where we have this, I think, what's the one in medicine? The Merck manual? Is that the thing? There's like a parallel in medicine where it's like, here are these diseases. And of course, there's new research coming out on many of those diseases, but what they are is relatively static, if I understand that correctly. And I'm not a doctor, a medical doctor.
Well, because once a thing is a thing, it's a thing.
Right.
Right. It's like, okay, this is what the skin rash is.
Right, exactly.
This is what happens when a cockroach crawls over your foot.
Right. Yeah, exactly.
And especially if it's in Madagascar.
Right. Yes, exactly. Here's this dog bite that I have that has this infection because of this bacteria. And it's like, it's pretty fixed.
Yeah.
And so we look at the DSM as if those things are always like that. But the DSM gets actually revised every handful of years based on new empirical data and also advancements in technology. And so the advancements in particular, when it comes to brain imaging technology, which were not a thing at the beginning of the DSM, have really changed the way that we diagnose. But there's also like all of this institutional fuckery when it comes to changing something in the DSM. So for example, CPTSD, which I see absolutely everywhere all the time, people 100% do not understand what it means, is not in the DSM.
What is that? What is it?
Complex PTSD.
How is it different from regular PTSD?
So the classic definition of PTSD is based on a simple trauma model where you have a singular traumatic event. So let's say you had a car accident or you got assaulted or you went to combat and had one kind of terrible situation happen. Complex PTSD is differentiated from simple PTSD in that it's trauma that unfolds over a period of time. And so that could be if you have neglect in your childhood, or if you had an abusive relationship that lasted for 4 years, or multiple deployments in the Iraq and Afghanistan wars that lasted over 9 years,
Sure. And that also applies to what's a spectrum disorder, right?
Yeah.
Like antisocial personality disorder, that shit keeps changing, doesn't it?
Yeah. Oh, totally. All of it does.
So it's fluid because it's not measurable in a physical way.
Yeah.
It's fluid because is it just essentially a bunch of people in a room saying, well, this is the behaviors that we're seeing?
Yeah. And then arguing about what that then means to change the entry in the book.
Right.
So I actually got to go to some of the APA meetings before they came out with the DSM-5 for PTSD. There were a couple of things that were being considered when it came to changing that entry. And one of them is that science has overwhelmingly shown us that the trauma response actually isn't a disorder, it's an injury. And so people want to change it to PTSI, post-traumatic stress injury.
Oh, interesting.
There was a really beautiful sort of side of the conversation arguing why that's important and how that would reduce stigma and help us understand and treat this more effectively. But then there's the other side, which says that injury is too vague a word. It's not specific enough to understand. You can't trace the injury in the brain. How does it relate to traumatic brain injury? How does it not? It's too fuzzy. And that side won. It's changing because of the new research and also the new technology, but it's also changing or not changing because of the institution that is the APA. And like all institutions, is problematic and flawed.
Yeah, I feel like schizophrenia and PTSD and like autism and all these things there's so little that we can see.
Oh, totally.
Like we don't know what causes it.
Also, the symptoms change in time, and
they sure do.
They change like depending on what society you're in.
It's almost entertaining to watch that community try to pinpoint it and say this is the thing and put it in a box.
Yeah.
And like, oh, we saw this new behavior. Oh, it's time to create a new category. And it's like the nature of those conditions is that they are constantly in flux, and it's funny to watch. But at the same time, as clinicians, we know that that's the case. And so like I don't throw around diagnoses lightly with a patient. Like if a patient asks me, if I got this diagnosis, and it's like, well, we can talk about it, but it would, like somebody with a personality disorder like narcissism or borderline, like they're really careful about diagnosing somebody like that. It takes years to say, okay, you have this thing. Yeah. Right.
And you can't be diagnosed until you're over the age of 18.
That's right. Yeah.
And that care is important. That care is a good thing.
Right.
But we in society, there's this like when we have access without education, the words and the languages trickle down into regular speech without the meaning. So then we end up just weaponizing these words. It's under the guise of being expansive and in tune, but it's the total opposite. People think that if they take a little course from someone who charges them $200 on Instagram to take a course that was called narcissistic, whatever the hell, that they then are experts in narcissism. And it's like, even the experts on narcissism will be less bold.
Well, it's the Dunning-Kruger effect. All over, everywhere. Seymour used to call it the delusion of mastery.
Yes, we talked about that last time. I love that.
Yeah. People love to sound like they know a thing.
Yeah.
Or they have a thing. Why do you suppose that is?
It's empowering. It's very easy to then blame things on this thing that you have or that you are.
But power to do what, though?
power over your symptoms, power over other people, tyranny in your relationships. That's the most destructive thing that I see.
Yeah.
And it literally, I've seen this happen in more than one couple, will tear a relationship apart.
Tell me what you've seen.
When someone weaponizes therapy speech, flings it, not in the name of expansion and understanding and attunement, but in an effort to manipulate and control. And I don't think that's even necessarily conscious. In fact, it's probably not conscious.
Could you sort of create a scenario where that might be the case? Like paint us a picture of what that might look like.
Do you watch couples therapy on Showtime?
No, of course not.
It's so good.
I can't. No, I don't want to.
I know you don't want to spend your time in your free time doing work. But the therapist is a researcher, an academic. She's a depth psychologist. She's studied dissociation for her entire career. She's really well established and she does a great job. And there's a couple on the show in this most recent season. I think it's Christy and Brock. They both grew up in a fundamentalist church. And Christy felt very stifled by the patriarchy. And so in her departure from the church, kind of grabbed a bunch of language about feeling safe, gaslighting, abuse. All of that was very real and was happening to her. And then she used it in her marriage to have tyranny over the relationship and create a situation where she was able to do whatever she wanted and her husband was not allowed to do anything at all. And anytime he pushed back against that, she would say, I'm feeling unsafe. This conversation doesn't honor me. You represent the patriarchy that I've fought so hard to get. And she would not budge or compromise on any single thing.
Wow.
And one of the situations that, just to kind of add more color to this, they were trying to figure out whether to open their marriage. He said, I think I might be open to that, but there's this one person that I would absolutely not be okay with you sleeping with. And she took that request as the patriarchy trying to oppress her and then slept with that person.
Jesus.
And then when he, in therapy, is trying to process his grief, which he's done a lot of work to try to process, she shuts him down at every moment and says that she is glad she did this. It was healing for her. He can't have dominion over her. Like, it's really corrosive. That's really outrageous behavior.
Yeah.
And I've seen not quite so extreme, but similar shades in couples who I've seen. I have this feeling when it happens of wanting to, like, it's like, you know, when there's like a kid who's like playing with a toy that is dangerous or that has small pieces that it might choke on. And you're like, all right, I can't make a big scene and grab this toy from this child because then they're going to have a fit. So I need to like coax that toy out of their hand and replace it with something else. I have that feeling of we cannot use the term gaslighting when every time your partner is asking for an accommodation. Jesus
Christ, that's scary.
It is scary. It's really corrosive. I think it's really dangerous, and we need to nip it in the bud.
It's like you're handing somebody with very little training, like here's a gun and here's a machete, and it's like they're much more powerful than people are aware of.
Right.
And so people like that. So what do you suppose is going on in our world that we have not trained our humans to know how to set boundaries and do all these things without relying on this shit to do it for them and do it to overdo it?
That's a great question. I think that there's probably 20 different factors. The kind of two that I see most obviously, and this is just given my kind of purview, are number one, I think we're in pain and we've been living through an incredibly traumatic time of upheaval. And I use that word in particular on purpose very carefully. And we haven't processed it at all.
You're talking about the pandemic.
Yeah. I think we entered into the pandemic with a severe lack of healthy coping strategies as a culture. And we are also a grief-phobic society. And so that is just a disaster. And it happened on such a large scale that I think we're going to be feeling the reverberations of that for a long time. I think they're almost entirely unconscious at this point. We haven't brought it out into discussion.
The trauma from the pandemic is lurking.
100%.
Oh.
And the second thing, just really quickly, and then we can circle back, is I don't think we value critical thinking anymore as a culture.
No.
And so whenever we feel uncomfortable, the easiest, quickest fix is to find a label to slap on something or to find a box to shove somebody in.
Right. Well, make ourselves the authority.
Right.
I mean, there's so much attack against, oh, you're a PhD, so what? Or you're a doctor, so what? God, yeah. Fuck you. You're just
I got a hilarious blowback on TikTok, TwikTok.
TwikTok? Let's hear it.
The TikTube.
What happened?
I started getting these really nasty DMs about people who felt like they had uncovered me because they found out that my degree was in a philosophy department. So I have an interdisciplinary PhD. When you have an interdisciplinary PhD, you have to be housed in a particular department. And my background was in philosophy because I did philosophy and psychoanalysis at the New School, which was also very odd, right? There's not another program that does that, I don't think, in the US. So I was housed in a philosophy department, and I did philosophy, neuroscience, and psychology. Because at that time, there was no such thing as like a department where you could get an interdisciplinary PTSD. That's a funny Freudian slip. You couldn't get an interdisciplinary PhD. There might be now. I'm not up on it. And so people will sometimes find that out, that I was housed in a philosophy department, which is not a secret. It's on my website. It's on my CV. It's on my LinkedIn. It's like, if I was going to try to hide something, I think I might do a better job. And they will say like, you're a sham. We've found out. You have no business talking about trauma.
This is from your TikTok account.
TikTok, yeah.
Yeah, where you were talking about trauma.
Yeah, right.
You and your trauma llamas.
My trauma llamas, yeah.
Oh my God. You just this like happy music comes on. Hi, trauma llamas, and it's like trauma llama. It's a dark thing, and you're like trauma llama. Happy music. Anyway, go on.
That's why they call me Dr. Sunshine, because I bring the light to the darkness.
I guess people just call me Dr. Darkness. Like there's darkness. I'm like, ooh, let's put more darkness in here.
Let's add the
let's get this. I got this dark lamp. Basically a lampshade with a brick in it.
That's a great faux business idea. You should make a TikTok about that.
I should.
Here's my dark lamp. It's to add darkness to your light.
I tend to go down the dark path. Like,
yeah.
So my neighbors, apparently there's this window that's right across from my window.
Okay.
It's an apartment complex. It's not across the street. It's like across a
courtyard
thing. And this couple moved in, and it's really easy to see them through my window.
Okay.
Like it's like they are there.
Yeah.
And it's a large window. And I'm like, oh gosh, I can see them. And like one night I saw one of them bouncing around without a t-shirt on, and I'm like, oh shit, that I'm not supposed to see that, but okay.
One of them,
won't say which. And a couple nights ago, I see this piece of paper taped to their glass. I'm like, what the fuck is that?
Oh,
and the
no.
curtains were closed. Is that some weird note to me? Did they see, they think I'm peeking? And I was all worried about it. And I get up the next morning, and it says, Dear Maria. Oh, dear Maria, we closed the curtains so you don't have to watch us sleeping. Here's a picture of us instead. And there was 2 stick figures on, and it's like somebody named Maria, I guess somewhere around here. Anyway, so what I was thinking of doing, because I like the darkness, as I was thinking of putting up a sign on my window that says, who's Maria? I have to know.
You should. I now have to know.
And now I really want to know who the fuck Maria is.
Let's find
because
out.
I need this darkness in my life. Peace and quiet, sunshine, virility. No.
How did they know that Maria was watching them in their sleep?
I have no fucking clue. I'll give you a tour of the place outside.
Okay.
It's like it's not clear
where anyone.
Like the most likely candidate would be me.
Maybe they think your name is Maria.
Maybe they do. Am I Maria?
You look a little like a Maria.
A very Jewish, surly, middle-aged, used up, over the hill Maria.
Oh my God. Your inner monologue needs work.
My inner monologue is perfect. Anyway, I'm curious about recovering from the pandemic.
Yeah.
Because I am seeing more patients in my practice now teenagers as well, who just lost a lot during the pandemic.
For sure.
Social skills,
Yep.
Health stuff, weight gain.
Years of their lives, like milestones that they should have been able to, or that they thought they were going to have access to.
Can you speak on that?
Yeah, I mean, I think it's interesting because there was a moment during the pandemic when Bessel van der Kolk, who is kind of a god in the field of trauma studies, came out, and I think he was quoted out of context, but said that the pandemic was not traumatic and it didn't count as trauma. And I think what he meant was that not everyone is going to have PTSD afterwards, because of course, that's not even true in a given, in something that we all agree, like a terrorist attack. We all agree that that's traumatic. 80% of the people come out of that experience without PTSD. 20% of the people come out with PTSD. So people took that up as like, oh, the pandemic's not traumatic. I don't need to worry about it. And I think we have not begun to get our head around the fact that, number one, what we were dealing with was happening on the global scale. Mm-hmm. That's unprecedented in our lifetimes. Nothing has happened on a global scale in that way. So there's no escaping it. There was this sense of trapped that was true, even if you didn't believe that the pandemic was real, because there was nowhere you could go to get away from it, even conceptually. And then two, there's all these losses and these experiences that people had, whether it's teens that lost years of their life or milestones, their prom, their graduation, things like that, or people who lost family members. We are bad as a culture at helping people go through those losses. And so what starts out as potentially traumatic becomes lasting trauma because we don't provide a relational home for it. And so how do we begin to process that? Number one, I think we need to accept that that's the case. Two, the pandemic isn't even over. And so we have to now kind of come to grips with the fact that, yes, we are no longer living in that acute moment of lockdown, but the world has changed in a way that it's not going to recover from.
You've seen The Leftovers?
No.
It's a Showtime series, I think. It's about 2% of the population just disappears from the earth.
Oh, wow.
And the whole show is about the trauma that the planet is incurring. This was made like 5 or 6 years ago.
Oh, damn, that's creepy. Yeah.
It's based on an even older book.
But see, even the movie is able to accept that that's, on premise, that is going to be a traumatic event.
I feel like American culture is very good at cruising or cruise control.
Yeah.
And I think that Americans do that a lot, where we kind of get in a groove and everything's going to be fine. And
totally. And also like ostriching, where it's like, this is not happening, this is not happening, this is not happening. And you're like, well, just because your head is in the sand doesn't mean that this isn't happening above the earth, Yeah.
So I think what happens is that there's a real lack of sophistication where people believe there is sophistication.
Yeah, totally.
Because they think, oh, I'm good at my job, I'm good at this, I'm good at that. And they think that because they have a grip in this area over here, that they've got a grip.
Totally.
I mean, you even see that in medical stuff. I mean, all that vaccine shit in the...
Oh, completely.
I mean, even if you really want a really brazen example, just listen to a bunch of flat earthers talk. They're amazing because they're actually really articulate most of the time. They're really smart people.
Yeah.
But there's such a deficit in their minds because they fucking think the earth is flat. It's like they're trying to compensate by cobbling together all these weird theories and about NASA, and that the airlines are all in on it too.
Yeah.
And it's like they got a whole really complicated system that's actually really well thought out.
Yeah. Right. And it's in the name of like expansion, but what it's actually doing is reducing. But that goes back to this idea of like critical thinking. We don't think critically anymore. And so rather than reflect and say, hey, I'm noticing that all of my friends are really needy and I'm feeling really depleted. How can I draw some better boundaries? And what role do I have in those dynamics? Instead of doing that, we say, you're an abuser, I'm going to draw a boundary, and then you burn the bridge. And that's so immature and short-sighted and not reflective. And the thing that I worry about with people that are doing that is that you don't ever stop to look at your role. So you don't ever actually improve when it comes to boundary setting. You're calling it an improvement in boundary setting, but what you're doing is burning bridges. And again, this is so tricky to talk about because there are people who need to get better at drawing boundaries, and they are reflective and they're using the same kind of therapy speak, but not in this weaponized way. That's not who we're talking about.
Yeah.
Do you think there's any pros to people having therapy knowledge without the educational scaffolding?
Well, it's a good question. I think it allows people not to keep things bottled up quite so much. I don't mean to go back to the cons, but the fact that it's always been bottled up means that when it comes out, it's going to be pretty crude and pretty messy, and everyone thinks it isn't when it is.
Yeah.
A cooler analogy would be if I'm at a party or something and I let it slip that I'm a therapist, which is always a mistake. I never get rewarded for that in a good way.
What do you say instead?
I don't know. I like, oh, you're a product manager. Awesome.
Right.
Tell me about that. I kind of say it in a super quick way. Like, yeah, I'm a therapist, talk therapy, like, I'll collect this with my hands. I'm a talk therapist. Oh, Woody Allen. But they'll start talking about their dreams in front of me. And talking about a dream in front of me is like taking your clothes off and jerking off in front of me. Yeah. It's like, so I'm not to say that my patients are doing that, but I'm saying that if we don't have this kind of relationship, just to kind of do that is insane and obscene to me.
My father was a dentist, and it would be the same kind of thing. You'd be like, I'm a dentist. Yeah, people would open their mouths and be like, can you look at, and you're like,
dude,
I'm at dinner with my family. Like, I do not want to look at your disgusting teeth right now. It's so not appropriate. You have not hired me. If you were my patient, of course.
Right. So more pros. So people are able to express their feelings more. I think men have more of an avenue of expressing their emotions, which is good.
But are they expressing, or are they hiding behind weaponized language?
I think it's a mix. I mean, I think you and I are like railing against this stuff because it's so repulsive, but I think that not everybody misuses it.
It's true.
Just the fact that therapy itself is becoming normalized means the whole that's one of the pros. That going to a therapist and actually talking to a professional is more acceptable.
Right. You can say it to your friends and family for the most part, and you're not going to be judged. Yeah.
Well, you will, but
not universally. Yeah. This goes along the same lines as what you were just saying, but I think like people are becoming more aware of their inner state.
or that an inner state exists.
Right.
This is what I realized is the problem with extroversion. I used to have all these theories, and I've realized really what it is. The problem with extroversion is the extroverted universe is finite. There's only so many dollars that will make you happy. There's a limited number of, couches that you can stick in your apartment. There's a limited number of places that you can visit.
Yeah.
Extroversion is finite. Introversion is infinite. It goes on forever. And I think that people are being very, very surprised to find this whole other resource that's actually much larger than
the whole inner landscape. Yeah. And just to clarify, you mean introversion, extroversion in the Jungian, not the Myers-Briggs way.
And they're not so dissimilar, are they?
I think the Myers-Briggs research has gone in a really different direction.
I don't know. My understanding of extroversion is that you put primary importance on things that are in the physical realm, and introversion is you put primary importance on things that are in the inner realm.
The Myers-Briggs frame, I think, is similar, but it's the idea that you get energy from the outside world versus energy from the inside world.
Well, that's not dissimilar in the sense that you put primary importance on things in the outside world, and obviously that gives you energy.
But I think there's like a depth to the Jungian frame that isn't.
Well, the problem with Myers-Briggs, and I go off on a thing here, is that it's too, Seymour used to say that precision and clarity are complementary opposites.
You talked about this last time, and it blew my mind.
And then as you become more precise, you get less clarity.
Yeah.
If you pull back and see the big picture, you lose precision.
Yeah.
So Myers-Briggs is too precise to be useful.
Yeah.
It's just, you can't talk about shit like that in a way that is super measured and make any sense.
Totally.
Like, I mean, the whole Myers-Briggs has the judgment versus perception shit in it. I don't even know what the fuck that means. And in my opinion, you can't separate judgment and perception. If you see a thing, you're judging it. If you judge it, you see it.
Yeah.
It's like, so it's just, they're trying to concretize and sort of, is scientize a word?
It should be.
And
Scientism is a word.
Make it into a science. It's not a science. Psychology, it's a soft science.
Yeah.
It's an art form.
Yeah.
It's a philosophy. It's an expression of self. It's not a cockroach in Madagascar on your foot. It's just not.
Aristotle said that if we cannot expect the kind of precision from the pursuit of happiness that we do from mathematics, it's just ridiculous.
Yeah.
He said it's absurd to do that.
Yeah, and math is also a completely closed system.
Exactly. Yeah. But I think when you say introvert, extrovert, I think people go to the Myers-Briggs.
Well, they shouldn't. Because it's dumb.
Well, it's reductive. It's so reductive.
It's reductive, but it doesn't know it's reductive.
No, it doesn't, which is super dangerous.
It thinks it's the shit because it has all these little researches attached to it. And this is the thing, and this is this thing over there. And it's like, oh, fuck off. So people are seeing this new world, and I think the way that they previously saw that world is with drugs and alcohol.
Yeah.
Not knowing it, of course. But like if you're in a situation and suddenly you blow some powder up your nose and you feel amazing, you're just like, oh my God, I can change
how I am in the world.
People spend so much time trying to make themselves happy with, material things and activities and such. And then the reason I think drugs are so powerful was sort of an instant, oh my goodness, it's all been here the whole time. And it is there, but you just don't do it that way.
Yeah.
So I think we're discovering ourselves. That's good. I think it's also humanizing people. It's easy to be a racist, bigoted shithead. Okay?
Yeah.
With language like this, it's not as easy.
Yeah.
Because that language is pretty neutral across everything.
Yeah.
And it's just like every person is a person.
Yeah.
And there's an implication in that I think is healthy.
Yeah.
To a degree.
Yeah, that's a great point.
I don't know. What do you think? What are some pros?
I think that, when we go internal more often and get more used to that horizon and know it better, we are possibly more likely to become better in relationship.
Right.
The thing that I worry, to go immediately back to the con, is that there's then this tendency to pretend that the inner landscape is this pristine, perfect place, and the outer landscape, when it comes to other people, is flawed. And so, for example, if your friends are really needy and you're feeling like you need to draw a boundary, that's a simple story that has a complicated structure underneath it that involves you. And so I think there's this tendency to be like, all of my friends don't understand boundaries. I understand boundaries. My inner world is pristine and perfect. I have no role in this. And I'm going to burn all these bridges and say, I'm drawing a boundary here. And I think in that case, you're kind of missing a lot of depth there that could be really helpful for your growth. I don't mean to just be judgmental. I mean, like, it's sad when people are using this language a lot of the time because they're not seeing themselves.
No.
What's behind the fact that all of your friendships are with needy people who never ask you how you are? Like, Is that because you're hiding? Do you feel like you can't be vulnerable? Where does that come from in your background? Is there anyone in the world that you do feel like you can ask for help from? You know, like
Sure.
there's a lot there that's not just about how other people are wrong and you're right because you now have access to your inner landscape. Does that make sense?
Yes, it does. So here's a question for you. How about clinicians and people who are educated who are misusing this language?
The thing that I always notice, and I don't know if this is the same, Gabor Mate is actually a huge offender of this, is folks who are so reductive in their language that it's almost ridiculous.
Say more.
So there are two things that Gabor Mate says very often that piss me off a lot. One is that there's no such thing as ADHD, it's all trauma. And number two is that if you have cancer or disease later in life, it's because you have been angry and you haven't dealt with your anger appropriately.
Jesus Christ.
Right. This is, by the way, speaking of expertise, Gabor Mate is brilliant. He has amazing work. I love a lot of the stuff that he's doing. I'm not trying to slam him.
He's a regular psychologist, right?
He's a physician who has no psychiatric background at all. He's worked in the space of addiction and he's done incredible work. I'm not trying to like trash him or cancel him.
Right.
But I think when we look at someone's expertise, we have to contextualize what it actually is. And he is reductive. And this is just his way. It's very provocative. But I've like seen him say to people who have cancer that the reason they have cancer is because they're angry.
Yeah, that's lame.
It's lame. And like, here's the thing. It's possible that a lot of ADHD is misdiagnosed trauma. And it's possible that anger is a contributing factor to inflammation in your body that leads to cancer. But to make that point so reductively is corrosive and harmful.
Yeah, and it also sounds like, hey, look at me. I've got this cool thing I'm going to say.
Yeah, it's dick swinging.
Yeah. I find that in my early career, a mistake that I would make was that I would mention diagnosis, just bring up the specter of it in session way too early. In the treatment.
Yeah. Before you even had any idea.
Before, not only that, but just bringing up the subject of it. Just talking about it, I think, is a bad idea early on.
Well, how would that come up? Because don't you have to give someone a diagnosis for insurance?
I would, well, yes, but I mean, like in session, it would come up like, yeah, you know, some of these things you're exhibiting are, you know, reminiscent of this diagnosis and this diagnosis and that diagnosis. And I think part of it was me either feeling insecure about myself as a clinician, like, hey, I've got to show them that I actually know what I'm talking about.
Yeah.
Or just wanting to look good. I don't know.
Or wanting to be like, here's what I see.
Yeah. But anyway, I was being too hasty with that, and they would, you know, cause a lot of anxiety. If you've ever watched two therapists have a conversation, it's really pretty fucking funny. It's like watching two priests talk. It's just like, they're just so fucking careful with each other.
Yeah.
Like, hey, I want to set a boundary on something. Oh, really? Okay, well, let's make space for that. And they're like, it's incredible to watch, you know, but they are doing themselves a disservice because they're not being authentic.
So you do see therapists talk using this, therapy speak,
but with each other and with, you know, their friends and whatnot. I think they're in a way they're the worst offenders because they know the most about that shit
and how problematic the language is.
And you see it on fucking Facebook. You know, I see like therapists post shit on Facebook with like something that quote unquote triggered them, like that word trigger that pisses you off so much that people misuse it, right?
Yep. So it'll be like someone posts like something in a therapy forum and then someone's like trigger warning, that kind of thing.
That kind of shit. Or they'll say, well, I'm a clinician and you know you can't say this, and this is what's real because I have this degree, you know, and it's like, fuck you.
It's all ego, like,
you know. And then the question, because you said access without education, the question is what is sufficient education? So, well, what does it take to get a therapy license, right?
Yeah.
It takes, you know, going to school and getting the degree, which is not incredibly difficult.
No.
It's just not. The hard part is the hours and the exam. The hours you could get, what if you have a shitty supervisor? What if you're working with a super easy population that doesn't really challenge you?
Yeah.
And then you have to take an exam, which is just a bunch of law and ethics, basically, right? Which is good.
Yeah.
I'm glad we do that.
Yeah.
But what does it mean to be educated? What does it mean to be, like, every time I look at you, I forget that your PhD is in philosophy.
Yeah.
You strike me as a psychologist. You just feel like one.
Right.
I can't explain what that is.
Yeah.
I defer to your judgment on things because I feel like you are. There's just an energy that people have when they know what the fuck they're doing. You can taste it, right? And that is dangerous because, like, well, you're giving people authority where they don't deserve it and stuff.
Yeah.
Super subjective because people do that with people who really don't know what they're talking about. They like idolize people.
Yeah.
But I'm in this funny position where I feel like I know.
Yeah.
But I can't prove that I.
Yeah.
It's kind of a funny thing. Like when you know a thing, but you know that if you went and yapped about it, you'd look like an idiot.
Yeah. Well, and I think part of the answer then is to say that.
I guess. I mean, the wise man analogy, I've used this one before. So someone goes to the wise man and says, hey, are you the wise man? And he says, well, if I told you I was a wise man, I wouldn't be very wise now, would I? But if I told you I wasn't, I'd be a liar. Right. And so what the fuck?
Right.
Anyway, so I think there is a certain degree of knowingness or education that exists within some clinicians and not others. Quite frankly.
1,000%.
I don't even know what it is.
Okay, so if the issue is access without education, what does it mean to have education? I think it depends on who you are, right? And to go back actually to philosophy, I think a lot of people don't realize that when you're in a field in philosophy, you have to pick a specialization. And the specialization that I picked was the philosophy of psychology. And so the philosophy of psychology, the whole of my degree and all of my research was about looking critically at the field of psychology, which is why I think I come off as a psychologist, because I didn't do a lot of philosophy. I did a lot of philosophy of psychology. It's a whole field. But I think that philosophy education that is missing from a lot of the world, especially in the United States, is critical thinking. It's a critical disposition. And I don't mean critical like I'm going to be a skeptical asshole, like a philosophy 101 student who just sees how to pull things apart like Socrates. That's not actually very sophisticated. What I mean is, like, can I take in this information, pause, figure out what pieces I don't have, and figure out how to get them? And that's going to look different based on who you are and what your context is. And so if you're someone on TikTok who doesn't have access to education, which is true of much of the country, I don't think that means you get let off the hook from being educated. Because if you have access to TikTok, you have access to the internet. If you have access to the internet, you have access to information. And I think it is our responsibility as citizens to figure out what the truth is in any given thing that we are exploring. And so there are resources now that were not available 10 or 20 years ago that are available to almost everyone, not everyone, but almost everyone, that mean that you could think critically about what you're seeing, what you're taking in, and figure out what the context of that is. Most research papers are now open access, which is wonderful.
This is kind of a random example, but I saw a funny TikTok this morning about a guy ranting about how they were grilling the CEO of TikTok. Spy stuff. Yeah. And he was like, recently we had a bunch of secrets released on fucking Discord by a 21-year-old IT guy who had access, who just wanted to prove a point to somebody to dick swing on the internet. Yep. And you guys are worried about TikTok. Yeah. It's like,
what in the actual?
Talk about like lack of education, lack of thinking critically, lack of Seymour always said it was really difficult to think in a straight line.
It is. And you have to keep yourself on task. I want to do this in a straight line. What does that mean?
On a larger scale, I think this is also an example of individualism run amok.
Yes, completely.
Because we put the success of the individual above everything, which means that your opinion, your thing, you got to climb to the top and shout as loud as possible. And if you can do that, you will be the winner.
Yep.
And I'm not saying I'm a socialist. I'm just saying that I think this shit's gone too far.
Totally. And it's, if you care about a thing, you should try to find out what it means.
Well, I'll get even deeper. So Seymour, one of his favorite subjects was epistemology.
Yes.
Yeah, the subject of knowing. And he would always challenge me, like, how do you know when you know something? Yeah. And I think that's what our conversation is about today. Yes. How do you know when you have a thing? Yeah, and say, this is mine. Like the Myers-Briggs people, they think they have a thing. And they do not. Right. They do not. And they've got PhDs and numbers and done studies and written books and are making lots of money and probably go to cocktail parties and people ask them a bunch of questions and they feel like they're awesome and they don't know shit. And I know it.
You know it. How do you know that you know that?
Damn, I don't know. But I goddamn know it,
Here's the thing, I think what we do is we have a fragment of a thing and we say, oh, I have the whole. I understand human personality. I have these 5 types and this is the Myers-Briggs platform and that's all that we need. And I think this is a place I see therapists do this a lot. I have this one modality. This modality, EMDR, works for everything.
It's so true. Like I had a supervisor when I was a trainee who was really into this one fucking modality of testing. Like that everything was a psychological test that people... Every time somebody opened their mouth, they were going to test you with something, which is true. I mean, there's truth in it, but it's like Freud and his fucking death wish, kill your father, marry your mother shit. Yeah. Like he just applied it to everything. Yeah. Yeah. And it's like people get a hold of one little fucking thing that might be real. Right. Because their minds are small. Right.
And they're uncomfortable and they want the reassurance of knowing that they have the thing. Instead, like it's not as satisfying or empowering to say like, oh, look, I found a fragment. Right. I want the whole thing. But it's always the more real thing to say, I have a fragment.
Yeah. I kind of make a living off of saying I don't know. It's something you can actually train yourself to do. Like when someone asks you a question, like actually, here's a homework assignment for our listeners. Practice saying I don't know to things more often.
And say it in a way that doesn't invoke shame.
Yeah. Because I remember back in the day, like when I would have a strong opinion about something, let's say political, I was very quick to say, this is the thing.
Yeah.
And now that I don't actually know the whole thing.
Right.
And people really think they have the whole thing, and they'll have little bits of information, and they'll use a story to loop together all the other, let's say someone who's invariably paranoid, right? And they've got two friends that one tells them a half truth about something and another one is like a complete misunderstanding. And they take those two things together and they decide that all of their friends are conspiring against them and hate them. And they just create this whole story.
Yeah.
You'd see that a lot in rehab.
Yeah, it's super common in general.
Yeah.
I always tell clients in situations like that to interrogate their thoughts.
Ooh, that's a good one.
Because it's like, what do you actually know? Not what is the conclusion that you think you know, but what do you actually know? Well, I have these two pieces of knowledge, and it might mean that my friends are conspiring against me. It might also mean that I don't have all the information, that there was some honest miscommunication or confusion. When I interrogate the thought, I actually find out that I don't know the terrible thing that I think that I know.
And I think it's also important that people create a dialogue with the story. So that you understand, this is what I know, and this is the story that I have about what I know, and I need to look at both, and think about them in a way that works.
Right, and what might I be missing?
Yeah, what might I be missing? Why is it so hard to do that? It's such an ego blow to do that, man.
To interrogate your thoughts?
Yeah, because you want to be right.
But I think like going back to your point, like if you practice it, like that's something I had to get super comfortable with teaching, because I don't know tons of shit.
Right.
And if I tell my students that I know things I don't know, that's unethical. It's also harmful.
So but you practice doing that.
Totally. It's not comfortable in the beginning, but now I'm like, oh geez, I don't, and I get reflected back a lot of the time. People are like, oh my God, you're so comfortable saying I don't know. And it's like, well, because I don't know the thing. Yeah. Someone was talking to me about some things about neurobiology. I know very little about neurochemistry. Mm-hmm. And someone was asking me a neurochemistry question. And I said, that's really outside my purview. Here's like the 3 things I know about neurochemistry, but I can talk about that in neurobiology. And they were like, oh my God, you're so willing to admit that. And it's like, well, what? Why wouldn't I? What is it going to bring shame to my family name if I say I don't know the entirety?
It's interesting. Well, again, if there's a problem in the culture, and we were talking earlier about why is it that people reach for this language, is because they're not comfortable saying that shit. They're not comfortable saying, yeah, I don't know what the fuck I'm doing, or how to ask for it,
or I don't know, but here's what I think I might know.
Yeah,
we need more nuance. That's the thing. I just did it again.
We need more punishments. We need to punish people, as I said earlier.
We've come full circle. We need to start. Foucault had a point in Discipline and Punish when he talked about how we need to be really careful because we think that we make societal progress because we take execution out from the public square and we now make it like a medical thing, but we're not making progress.
Oh, wait, what?
Okay, random.
You brought up fucking Foucault. It's like it's in the gloves are coming off. Like
Foucault.
She's gonna bring up Derrida next and some other motherfuckers.
Derrida, man. He actually taught at the New School right before I was there, and people called him Jacques, and I was like, I'm sorry, are you talking about Derrida? Like, are we calling him Jacques?
They actually called him Jacques?
Yeah.
That's fucking hilarious.
I know.
She just called him Jack.
Jack.
Yo, Jack.
Hey, Jack, what's up?
What's up? How's the postmodern doing?
Have you deconstructed everything yet?
Yeah.
No?
Yeah.
What was the question?
I don't know. You were talking about Foucault.
Oh, so Foucault makes this Discipline and Punish is one of my favorite books just because I think it's such a fucking perfect argument. It's kind of a wide sweeping analysis of the ways in which we see discipline in our lives and the ways that discipline can transform and actually internalize, and we become self-policing. And it starts out in school. Mm-hmm. We become docile bodies that are expected to behave a certain way for a certain amount of time, sit in a certain chair, do certain activities. And if you do anything other than that, you are, deviant or whatever. Mm-hmm. And in the very first chapter of Discipline and Punish, he talks about how we think we've made progress with what we call discipline because we've sort of like anesthetized it. And we used to draw and quarter people in the town square, which is when you would literally attach people's limbs to 4 horses and have them run in opposite directions. Mm-hmm. And we would stone people in the town square. And he says, now we've relegated capital punishment to the basement of a prison where it's not public anymore. It's very medical, but that does not mean we have made progress.
Oh, interesting.
And I think living in the time of cancel culture, I think we can see that very clearly. Like we have, in ways he couldn't have possibly thought about, we have become so much more cruel to people.
It's a form of public execution.
Oh, yeah. And a far more brutal one because you survive it.
Yeah. I think I'd rather be canceled than drawn and quartered, but I hear your point.
Well, do you know though, like that, like people's careers get entirely fucking ruined. Their families are destroyed, like because someone didn't like their face on a YouTube or whatever. It's just like
they didn't use the right pronoun or some shit. Okay, is there anything else you want to add?
The topic is access without education. I think we have access. I think we pretend we don't have education. And I'm not saying that the educational system is not flawed and problematic and privileged, but I think we have more education than we think, and we need to do a better job of thinking critically.
I agree. All right, Mary Catherine McDonald, PhD in philosophy with a specialty in, what was it?
Philosophy of psychology.
Philosophy of psychology. Sorry.
That's good.
PhD in philosophy. Okay, Mary Catherine McDonald. Okay, anyway, that was all fucked up. I'm not going to add that.
Okay.
Thank you so much for coming. You were amazing as usual.
Thank you. This is so fun.
And we will do we have a preview of what else we're going to be doing?
Yes, we have 2 more in the works. 2 more in this series. Mm-hmm. One is on personality disorders.
Oh.
So how the cluster B, and in particular how the cluster B sort of thing is being misused. And then one on psychopaths, sociopaths, and serial killers.
Fun.
Yeah.
All right. Thank you so much.
Thank you.
Thank you for listening. Again, if you would like to become a Patreon member, see the link in the program notes. And if you would like to be a guest on my show, ask a question, or just say hi, my email address is benjaminrussick@gmail.com. Thank you so much, and talk to you next time.